Welcome back, everybody, to Dr. Sellers Educate. We're happy that you're back as you continue on your journey towards achieving success. If you haven't already subscribed to this channel, go ahead and subscribe right now. You may be listening to us on the podcast or on our YouTube channel. Either way, we want you to be alerted as soon as the new episode is available, which usually is every week. Our mission is simple here at Dr. Sellers Educate. That is to support every nurse educator to achieve certification by the NLN. You may be on the journey to taking your CNE Novice. That is a new one that was released this year in 2022. Make sure you go to nln.org to review all of the eligibility criteria associated with each of the exams. Okay, so CNE Novice, if you have less than 3 years of experience, that may be a better exam fit for you. Check out the website to learn more. CNE is the exam that is designed for the academic nurse educator. And then we have the CNE Clinical, which is designed for those clinical faculty that really are focused on how we best serve our students in the clinical setting by ensuring that we are closing their knowledge gaps and allowing them to apply safe nursing practices in the clinical setting. For our purposes of this episode, we will be focusing on evaluation strategies. This is going to be relevant for clinical faculty as well as for those academic faculty. We're going to use our Billings and Halstead resource primarily for our conversation today. If you want to take a look at chapter 24, there are a couple of great resources here. First of all, there is a chart that we absolutely encourage you to take a look at. So it is table 24.1. Overview of evaluation strategies. This entire chapter is really going to help you close your knowledge gaps as it relates to evaluation strategies. How we evaluate students' learning in the cognitive learning domain, psychomotor, and affective domain is different. And we're going to cover all three in this snapshot. We also are excited to share that we will have Dr. Lisa Drews presenting this coming Friday, November 4th at 12 noon. This is our last free webinar of the year as we work on focusing in December our curriculum for 2023 and what our schedule is going to look like. So we're excited to have Dr. Lisa Drews join us from Wilmington University, where she serves as the chair of the MSN program, leadership program, and also she is an associate professor there. She has her credential as a CNE and a CNECL. So we'll be super excited to have her expertise in the room as she focuses on the technology of Padlet. Have you used Padlet before? Well, if you haven't, you're going to have a hands-on psychomotor experience. We're going to tap into the affective domain as well as the cognitive domain as Dr. Drews presents this great information to us on Friday. So don't miss it. There's information in the description about how to register for this amazing free webinar. If you already have your CNE or CNECL, remember that in order to maintain your credential, you are required to complete ongoing webinars or programs to help you strengthen your learning in all of the competencies that are listed by NLN. Okay, so you have to ensure that you are being in compliance, staying in compliance with your designation as a certified nurse educator. So we like to offer those webinars to all of our nurse educator colleagues out there. All right, so let's go ahead and jump into our content. Again, we're going to be using our resources. We are not endorsed by NLN. We simply believe and support their recommendation, which is to ensure that we are closing our knowledge gaps by using the recommended resources. Dr. Billings and Halstead, Teaching and Nursing Resource 6th edition, is the one that we use as we talk through our content for this episode. And also for you all that are on the journey to achieve your CNE, you will be using Dr. Caputi's 2nd edition review book. And on the CNECL journey, you all will be using Teresa Schellenbarger's CNECL review book. If you have any questions, you can always reach out to us at Dr. Sellers Educate, info@drsellerseducate.com or drsellerseducate@gmail.com. This is just a snapshot, just a picture of us, our table that we had at the NLN Summit. We were so excited to see so many of you all there and also about the amazing topics that were discussed. As we look at how we correlate and evaluate our students' learning across domains, it's important that we are knowledgeable about those specific teaching strategies. Looking at starting on page 453 in chapter 24, there's discussion about our role as educators to be mindful about the different learning domains, the 3 learning domains, which you see here, and then aligning our teaching strategies with all 3, but also our evaluation strategies. Okay, so that's what we're here to talk about in this snapshot. Specifically looking at the cognitive domain, we know that we are talking to students in the classroom about specific concepts, right? We think about Bloom's taxonomy, the different levels of learning that happens under the cognitive domain. We know that remembering is that lowest level, and then creating is the highest level for Bloom's taxonomy. When we look at the cognitive domain, we spend a lot of our time in the didactic setting developing reliable and valid exams to ensure that we are evaluating and validating that learning has happened with our students. We do that through exams as one primary way, but ultimately what we're hoping to do is to be able to assess the transference of knowledge that we have shared in the classroom setting, that students have connected the dots to be able to answer questions correctly on an exam. When we look at table 24.1, you will see a couple of points that we want to highlight. First of all, when you look at exams, we know that it does connect with the cognitive domain primarily, right? Because usually there are questions that are hopefully introducing specific patient scenarios or disease processes, and students are choosing the best answer. When we move to the psychomotor domain, we really are looking to evaluate students' ability to perform clinical practice behaviors in a safe way. That's ultimately what we're evaluating. So as you take a look on page 453, our resource tells us that specifically cognitive learning is typically assessed or evaluated with strategies requiring students to write, submit portfolios, or complete tests. Assessment in the psychomotor domain typically involves simulations and simulated patients, and ultimately it occurs in the clinical setting. And then we have evaluation in the affective domain that is important, specifically related to receiving, responding, valuing, organization of values, and also the characterization by a value or value complex. All right, so when we think about affective domain, it really is progressive and it develops over time. Our nursing students are able to ultimately make clinical decisions with the information that they have received in the didactic setting, or even in the lab setting or simulation setting, and ultimately to be able to apply their learning safely in the clinical setting. When we think about ways that we evaluate specifically our psychomotor and affective domain, because cognitive domain is pretty direct, right? We can all describe, identify, and talk very clearly about how we evaluate students' cognitive learning domain. Psychomotor also is often easy for us, but affective sometimes can be a struggle. So let's take a look at table 24.1. Portfolio, you see that this can be either paper or electronic. It has a high level of connection to our cognitive domain. Students are compiling a lot of different information about their expertise, about their practices as it relates to their background, and they are often submitting it part of a project in our courses, or even when they're applying for their first job, right? We want students to have a solid portfolio, and we have to have an understanding of the different domains that it touches on, as well as examples of what the advantages are and disadvantages as it relates to each of these evaluation strategies. All right, so let's just look at portfolio as an example. It connects with cognitive, but also affective. Okay, it connects through the affective domain because students are really compiling the information about themselves and packaging it in a way that tells a story about their expertise and their knowledge. Psychomotor, if it's a video, students are able to demonstrate their ability to insert a Foley or to have to demonstrate effective communication skills that they may have perhaps with the student or a simulated patient. And we also can use portfolios as a formative evaluation strategy where we are giving students feedback about content that they should include or should not include. And then also it can serve as a summative evaluation where students are submitting it as a final project. So there are lots of different ways that we can, for example, use portfolio. All right, so let's cover a couple of different elements, and then we'll wrap up for our snapshot today. What I also want to highlight is that as you think about your review for this specific concept, you want to walk through table 24.1 and chapter 24, starting on page 455. What you want to focus on are three things, okay, as it relates to evaluation strategies. Number one, what is the evaluation strategy? For example, we know it's portfolio. Is it paper? Is it digital? Is it video? Okay, so if there are different delivery methods of that specific evaluation strategy, you want to know what content, what information there is in our resources about that specific evaluation strategy. All right, so that's number one. Number two, we want to know what domain specifically does it align with or match with related to the type of evaluation that's being conducted. And then the third part that you want to make sure you understand, what are some of the pros and cons with that specific evaluation strategy? What would be the benefit of using it? And what are some of the possible risks associated with using that evaluation strategy? All right, so with portfolio, let's just finish up. So the next column says possible applications, placement in the program of study, evidence of progress, demonstration of professional development. And then we have advantages. Obviously, it's a great way to sample students' work. Also gives a great opportunity for students to reflect on all of the wonderful accomplishments that they have completed. So it's a little bit of a celebration for them. Think about when we submit our portfolio as tenure track faculty, for example, we take a lot of pride in pulling together all of that information. I don't know about you, but it took me days, several days to compile all of my writing examples, all of the syllabi, course evaluations. There's a lot of information that goes into portfolio. So we want to encourage our students to pause and take time to really celebrate all of their wonderful accomplishments. There's also some disadvantages to portfolios. First of all, as I mentioned, it's very time consuming, right? We want students to present their best self in this portfolio. So it does require them to commit to a significant amount of time. We want to share with students from the very beginning with this assignment how much time they should expect to commit to put in their portfolio together. And then the final column talks about issues. Specifically the ownership, who's responsible for the collection. Are you assessing process or the product? That's a really good question. Deciding on the format for organizing the portfolio. So these are all considerations that you want to take into account as you are closing your knowledge gap as it relates to evaluation strategies and managing across or matching across all domains. Managing too, right? We want to make sure that we're doing a good job of evaluating students' learning. If you have any questions, make sure you reach out to us. This is the conclusion of our snapshot for our time together. We hope this has been helpful, and we will see you on our next episode. Have a great one, everybody.